Hello everyone, I'm Hu Bin from Department of Gastroenterology, Eastern Capital Biliary Surgery Hospital, Shanghai, China. This is my colleague, Associate Professor Gao Daojian. I'm honored that our article entitled Endoscopic Radiofrequency Ablation plus plastic stent placement versus stent placement alone for unresectable extrahepatic biliary cancer, a multicenter randomized controlled trial has just been published in GRE, an internationally prestigious journal of gastroenterology, which greatly encouraged all our team. The study was carried out in 3 centers in Shanghai, Hangzhou, Shenyang, China, which started in the spring of 2013, completed the patient's enrollment in 2018, ended the follow-up in July 2019 until a paper was published. It lasted for more than 7 years. Here, we sincerely thank the team member for their hard work and all patients participating in the trial, and their family for their generous support.
Extrahepatic cholangiocarcinoma and ampullary carcinoma are not very common, but they are not rare in the Asian region. The morbidity and mortality are increasing. Yes, early diagnosis of biliary tumor is difficult. Radical surgery is usually impossible clinically, and the resection rate is less than 30%. Although the clinical diagnosis and treatment technique has been improved in recent years, the mortality has not been significantly reduced. Endoscopic and percutaneous biliary stent placement remains the mainstay palliative treatment for inoperable biliary cancer. Although it can relieve jaundice and improve patients' quality of life, it cannot prolong patients' survival, and the median survival of most patients is less than 6 months. In China and some Asian regions, patients with biliary cancer have shallow acceptance of radiochemotherapy. Therefore, the prognosis of a patient with biliary cancer who are unsuitable for radical surgery is very bleak, which urges us to explore radiofrequency ablation in the bile duct to improve the patient's survival.
Our center was exposed to Habibi radiofrequency catheter for the first time in 2011 and took the lead in a clinical trial in China. Through a dozen clinical applications, we found that the endobiliary RFA is safe and feasible in treating malignant bile duct obstruction, and is easy to operate with few adverse events. It seemed to prolong the survival of a patient. However, the study published were basically retrospective, single-arm, and small in size, lacking large, multi-center randomized study. Therefore, in 2013, we started this study in conjunction with several biliary pancreatic centers in China.
According to our initial experience, we assume that the multiple ablation section might be more helpful to improve patients' survival benefits. So we designed a protocol of 2 consecutive RFA treatments and exclusively use of the plastic stents. When registering this study, there was a lack of clinical data about RFA. When determining the sample size, we referred to the general phase 3 clinical study of drugs, and planned to enroll 240 patients, with 120 in each group. However, after the project is initiated, some centers could not carry out this project and withdrawn from the study. Besides, all eligible patients needed a pathological confirmation and randomization and received 2-session treatment. Therefore, it was much more difficult for patients' enrollment than expected. At the end of 2015, we made an interim analysis for 63 patients. We found that the overall survival of the RFA group was significantly higher than that of the stenting alone group. This result was already presented in DDW 2016. Subsequently, we adjusted the samples based on the interim result until the patient's enrollment was completed in 2018.
In this study, 174 patients with an inoperable extrahepatic cancer confirmed by pathology and cytology was included. The results show that, compared with the standing alone, the intraluminal RFA for 2 times plus plastic stent placement could not prolong the plastic stent's patency, but could significantly improve the prognosis of patients. The median survival was extended from 9.2 months to 14.3 months, and the patient's quality of life was enhanced considerably within 9 months. The survival benefit could be presented in all subgroups of higher cholangiocarcinoma, distal cholangiocarcinoma, and ampullary carcinoma. Generally speaking, RFA did not increase the incidence of a severe adverse event, but the risk of acute cholecystitis increased after procedure, especially in patients with a higher tumor.
This study is by far the largest multicenter RCT on biliary RFA, suggesting the efficacy or safety of this novel technique for the patients with inoperable extrahepatic biliary malignancies. We believe that we still need to explore the following 2 aspects in the future. First, the optimal RFA strategy needs to be determined, such as comparing single RF ablation plus metal stent drainage with multiple ablation plus plastic stent placement and observing the efficacy, safety, and economic benefits of different therapeutic regimens. Secondly, according to the recent advancement, the role of local RFA combined with systemic anti-tumor therapies should be investigated. The further studies will help us to provide better and more efficient care for patients with bile duct cancer.
Thank you very much.
Thanks.